The new obesity medicine group is the American Board of Obesity Medicine, and what we're looking for, obviously, is to move into another specialty, subspecialty in obesity medicine. The goals of that particular organization is allow for some standardization of education, that physicians have a common goal and a common assessment of knowledge skills, and then move forward with formal treatments of obesity. We hadn't had any boards in obesity medicine, so it's sorely needed, and I think our numbers are up well over 800, so very excited about the future. Well, type 2 diabetes evolves first out of obesity, so we tend to call this diabesity. So by making bariatric interventions very early on, we can sort of curtail the incidence of type 2 diabetes, unlike type 1 diabetes. And it also occurs a lot earlier in children. So if we can go at early interventions with obesity with children, we think this is a way we can stop diabetes or type 2 diabetics. Medications have been used. It's just obesity is a multifaceted issue, and there's a high side effect profile with many of these medications. We have at least 2 are coming on board, so we hope we have learned from our past issues with this, but there's going to be a whole host of new medications come on. So I think we're going to be much more successful with obesity interventions with medications in the near future. Be patient with us. Absolutely. The data is very clear. If patients are prepared for the surgery and then post-surgery, about 2 years after the surgical intervention, we begin to see our highest relapse rates. Those patients that were involved in both pre- and post-surgical interventions have much less relapse, so it's absolutely important in Sentinel they get that kind of prep. I think when we're looking at adolescent populations, actually adolescent bariatric surgery is one of the quickest growing surgeries across the world. So you need that option. If you look at the NHANES data, actually obesity in males who are over 97th percentile, which is morbidly obese, those are patients that are getting worse and worse. Bariatric surgery offers a very important option for them. So absolutely. Yeah, basically this is a tool we use for mindfulness. We often speak of mindfulness. We like to look at neurolinguistics. What kind of mindfulness, why and where? And we've developed a little tool called the flow game. It takes about 15-20 minutes to carry out this endeavor. And patients at that time under stress, when we ask them to think about stressful issues, locate one of 5 rooms in their mind, and we call that their home room. The idea of mindfulness then is to integrate the 4 other options, and that's called resiliency. So with our bariatric patients, we found those who first understood their homeroom, that's the place they go under stress, and then were able to integrate the other 4, had a much more resilient approach to their obesity. Easier to manage, and it really helps out with mindfulness processes. Yes. The Duke program especially, had heard of Wellspring too. I think it's to stay patient, stay on task here, where we see the federal government and worldwide government's addressment of obesity. I think you're in an ideal and pivotal situation. So patience, a little bit more time, and I think you're going to have great outcomes.